Yes. Good morning, everyone. I am Vukosi Marivate. I am the Chair of Data Science at the University of Pretoria, and this is a continuation of our, this is a continuation of our Data Science for Society series of seminars that we're having basically in this half of the year. We tend to do this. This is just continuing that project and all going on there. Today we are collaborating with the HSRC and some great colleagues from HSRC and UCT. We have Vedantha Singh from UCT and Rachel Adams also from the HSRC. We will be talking today about AI and data in South Africa's health sector. It's very topical at the moment on there. The format of today is going to be in such a way, I'm just going to have Rachel introduce us to this policy action network topical guide series that they've been working on. After that, then we will then have Vedantha talk about the AI and data in the health sector project that she was the main author for. And then we'll go through some questions. I have a few, and then open it up for Q&A for everybody. Just FYI, we do record these seminars, and they will be made available afterwards. We will put them up on our blog, and the YouTube links will also be available for anybody. Just to note, as we kind of continue working on here, please, you will stay muted. If you are asking questions later on, you can switch on your camera just so that we can see you as you're asking that question, but we'll kind of go on. Rachel, would you just kick us off? Just let us know a little bit about your background and about this program.
Hi, good morning, everyone. Thank you ever so much for Corsi. So yeah, I am Rachel Adams. I'm based at the Human Sciences Research Council in a new centre called the Impact Centre. And this centre is a centre that's seeking to bridge the gap between research and policy. And one of the kind of flagship projects for us has been around thinking through the policy implications of artificial intelligence, or to simplify this in very simple in more simple terms, the use of data in society, big data, and how it may affect the policy regime and how it may affect society. So towards the end of 2019, myself and a colleague also at the HSRC, Dr. Paul Plantinga, developed a collaboration with Vukosi and also with Willem Fourie, also at UP, to initiate a series of policy briefs, which we called topical guides on AI and data. And the idea was to look at the current policy commitments around data and the fourth industrial revolution and artificial intelligence, and to think about how they matched or mismatched with existing laws and policies that were more directly socially aligned. So whether that was human rights or the NDP, or the white paper on the integrated ICT white paper that talks very much around issues of access to ICTs. So I think the first guide came out, yes, actually 5 guides came out together in March. This is funny, seeing all the doorbells come in. Welcome to the new people that are joining. So yeah, we developed a series of sectoral guides specific to different sectors that were using or thinking about using artificial intelligence and data in quite serious ways. So we developed a first one that was just an introduction to the series, and I will try and get the website that has all these topical guides put on the chat. So the first one was an introduction to the series, and then we had one on migration and biometrics and securitization. it articulated some of the pitfalls, some of the potential problems with using data in this sector with regards to bias and exclusions, and trying to develop a series of recommendations to how this can be addressed. The third one then was on smart cities, the use of data in smart cities and towns in South Africa. We had another one on education, and we had another one on policing and crime prevention. So these were all written by various evidence experts in these areas. And now we have the sixth one out, which is on health and artificial intelligence and data that Vedantha Singh authored, and she's going to speak to you in much more detail about that, which is of course really, really topical. But overall, the guys were seeking to sort of understand how data and AI can be used in ways to promote an inclusive and just society and address issues around poverty and inequality and unemployment. There's been a lot of policy discourse within the kind of Fourth Industrial Revolution Commission space that talks about how the 4IR is going to bring about inclusive economic growth. And part of what we wanted to do was say, yes, that's all very well, and there are very many meaningful ways in which AI and data can be used to advance society. But we need to think carefully about how the negative effects of using data and AI, and think about how to address these within the different policy spaces. So Vedantha will talk about this in relation to health. But I think there are three key concerns that were a motif throughout all of these topical guides. So the one was access to who has access to these technologies. The second one was bias, who may be discriminated or face bias as a result of these technologies, these systems, and these products. The third one was around who is getting left behind, who is able to benefit from these technologies, and who doesn't have access, and who are we failing to think about including, who do we need to actively include. And then the fourth one was a real concern around the lack of awareness generally about the extent to which database technologies are being used in society and people's rights, data rights in this regard. So there hasn't been a great understanding of what rights people have to challenge data-based decisions based on data, or to challenge any violations that they may experience as a result of data processing or related personal data use. So that was another major challenge that I think we found in all of these guides. Obviously now the Protection of Personal Information Act, when we were first doing this work, we were still waiting for it to come into effect. It came into effect 1st of July, so that marks a major shift. Although we have a year in which to comply with the Act, the fact that it is now in existence provides critical political will to try and make data protection, personal data protection and privacy something that is visible and clearly articulated within all different policy spaces. So I'm going to hand over to Vedantha, who will talk much more specifically about AI and data in healthcare, and the health sector, which is of course extremely topical at the moment. And Vedantha had a number of incredible findings and many useful recommendations and summaries. So I will get the website with that guide up on the chat so you can all see, because it's a really, really wonderful guide. So thank you for Kosi, and over to you, Vedantha.
All right, thank you for that. I don't know, hopefully my camera's back up. Yeah, thanks for that. Okay, we're going to have Dante Singh, who is a researcher and PhD student at the University of Cape Town. Her major focus in her work is understanding the impact of AI on healthcare, specifically how it relates to agency and organizational change. She's trained in the biomedical sciences, and she has developed and supported leading research programs tackling HIV, cancer, and HIV. Oh, sorry, NTB. Oof, oh my God. All right, Vedantha, it's then up, yeah, going to be on you. Thank you.
All right. All right. Good morning, everyone. Thank you so much for joining this morning's seminar. It's really an honor to be here presenting to you. Before I start, I wanted to thank Vukosi for organizing this seminar, and a huge thank you to sort of Rachel Adams and our colleague Paul Platanga from the HSRC for the continued guidance, and they really helped make this guideline document possible. It's a very important step that we are taking by thinking about policy around data and AI, especially as we come into light where health matters, not just for health's sake, but now also for the sake of the economy. And we are realizing that with the new COVID environment that we find ourselves in. So what I'm going to do this morning is I'm going to just quickly share these slides with you, and want to quickly go through the presentation real quick. I'm going to stop my video just so that there's no Wi-Fi issues. Okay, so the Policy Action Network allowed us to develop a guideline on AI and data for use in South Africa's healthcare sector or health sector. And what I did was, when I was given this task, I decided to fully research what was happening around the policy space around data, specifically health data. And then I also wanted to know about how many of those policy documents brought the concept of AI into the conversation. And so what I did was I looked broadly around multilateral frameworks and strategies, also looked at some policy think tanks, and then I narrowed that down to a few countries who were working on health or data related policies. And then I looked at, well, what does that mean to our very unique South African context? And from there, I drew on a few recommendations, a few of the common understandings and some of the common problems or concerns that these frameworks kept bringing up. And I tried to look at that through the lens of South Africa's digital health context. And I came up with a set of around 8 recommendations. So I'll just go through these for this morning's presentation. The first thing I want to start off by sort of contextualizing AI in health. And very recent news articles have come up in, for instance, FinTech did a study looking at around 80 industries or 80 companies working on artificial intelligence solutions. And they found that there's an increase in demand for AI solutions in health in response to COVID-19. In fact, more than 93% of respondents have now started looking at the ethical considerations, and they've identified those as barriers to AI adoption. And that's incredibly eye-opening to see that it is, even within industries, it is an important barrier, and it's important to look at the ethics of using AI. We also found in this report that many of the organizations involved in AI in healthcare have mentioned that even though addressing these ethical concerns is going to be a monumentous task, it is something that they are willing to spend the time working on. I also found a recent article as early as, I think, yesterday, about how AI is going to ensure a more inclusive digital economy. And this article picks up on the health sector and how AI can be used to sort of streamline and promote an efficient health sector going forward. And AI is being used throughout healthcare, and I've got many sort of diagrams showing this. where you can use AI across the patient journey, from diagnostics and treatments to discovery of genes and discovery of drugs and therapeutics for diseases, looking at optimizing, for instance, workflows and patient flow optimization, looking at predictive risk models, virtual assistants, which we see a lot now in the sort of wellness and health sector. I mentioned a little bit about precision medicine, but using for the first time big data sets to come up with precision medicine is probably going to be one of the more exciting uses of AI in healthcare. And if you think these are just things that are sort of in the future, I'm here to say that the future is here, because we've got many hospitals all across the world using, for instance, the IBM Watson program to assist with detection of cancers and augmenting and streamlining patient information. And there's fairly a large number of books around AI in healthcare. For instance, Deep Medicine by Topical, and one of the good books that I really enjoyed reading during lockdown is Tomorrow's People by Susan Grenfell, and The Future of Professions. And this shows you that we are living in this change. We've got to address it, unfortunately, while we are in it. But it is important to know that it is here and it is used across the health sector. And so I've taken this from the policy guideline, and I've tried to develop more or less a landscape of where AI technology can be used across the health sector, starting from population health, where we talk about surveillance and prediction, mapping spreads of diseases. In COVID, that's something that we have found companies such as Blue Dot are doing very well at the moment. We look at moving towards the individual health and wellness, where AI can be used together with wearable devices to track pathways to care, prevention of certain diseases by monitoring behavioral changes in diet and exercise, and then moving towards how AI is used in the health systems. It's really important, firstly, to have an integrated electronic health record in order for health care systems to take advantage of AI. But I strongly believe that AI can be that catalyst to pull together some of the laggards in this field. It's important to look at AI in how we can create capacity planning and predict resource management. Okay, and then moving on to the biomedical, pharmaceutical services, where AI is incredibly important, not only for drug and vaccine discovery, but also for optimization of clinical trials, and in making sure that those clinical trials, which usually take years and years, we manage to model those using AI so that that time from benchside to bedside is limited. And that's a fancy way of saying that we ensure that our vaccines get to people sooner, or therapeutics get to people sooner. And AI has been very important in optimizing not only that, but the supply chain side of resource management and drug development. So really these few slides are to show that the adoption of AI can happen across the patient platform, across the patient journey. And we need to ensure that the ethics and the legal aspects of using this technology and using data for these applications are well established, or at least are set upon a stable, standardized precedent. All right, so looking closer to home, AI is being used within South Africa, and a recent report compiled by the University of Pretoria, I think my colleagues Vukazi could speak a little bit about that. And that report showed that definitely there's huge scope for AI in South African healthcare to supplement the shortage of healthcare professionals that we have, that we are dealing with in South Africa at the moment, as well as to mitigate some accessibility barriers. Rachel mentioned earlier that one of the key concerns of the using data and these technologies in any case is the reach of these technologies. It doesn't make sense to have just some people benefit from them. This is really an opportunity that we are faced with now to make sure that technology is used as an inclusive tool and not one to further fragment people. And so closer to home, I've got a few examples here. For instance, Discovery Health's Doctor Connect, which it draws on data relayed from wearable devices. And so these are your sleep data, behavioral data, mood data. And it compiles these data and draws conclusions which will basically help with your doctors diagnosing certain conditions. Other companies such as Cortex Logic are branching into healthcare at the moment. But one of the more prominent examples of AI is Broad Reach. It's basically in combination with Microsoft, and they've come up with a machine learning based system called Vantage. So this system helps clinicians assess performance and making staff and operational recommendations. And this was used in HIV clinics. And it was used to test more than 5.5 million people within a period of from 2012 to 2018. And there are a few other examples, which I won't go into too much detail for the purpose of time. What I will say is that whilst we it's difficult to sort of visualize the developments we've made in the AI sector, I wanted to make a point that we are not starting from scratch, specifically from a policy point of view. I was surprised to note that there are a host of multilateral frameworks and strategies in place, not just from these huge bodies of multilateral leaders such as the World Health Organization and the UN, but there are also policy think tanks and advocacy groups that have come up with guiding principles and frameworks specifically focused on the ethics of data and the ethics of using AI in relation to health data. In addition to that, there are also a number of countries that have developed national strategies of using AI in health data. And some of the countries that I've mentioned in the guideline, but these are not limited to, are the USA, the UK, India, France, and Rwanda, who I think we mentioned in the policy guide, and they've done incredible work in starting the conversation around AI ethics and governance, especially data innovation in healthcare. They've hosted, several international conferences around data and AI innovation in health, such as the Digital Health Hub in 2018. So I think they are really a shining example of how to start the conversation, start acting around AI innovation in healthcare. So I'm going to take you through some of the key findings from the multinational organizations. And the very first one I want to talk about is the World Health Organization. Excuse me. They've come up with a host of guidelines and principles. And one of the first ones that I came across was the Global Strategy on Digital Health, where they call for an interoperable digital health ecosystem. Now, that is an important consideration when we are talking about AI, in that we need sort of a standardized platform across all our digital health systems, so that these systems can speak to one another. And I think that's an incredibly important principle when we are in a case like South Africa, where we are starting to develop our infrastructure. So make sure things are standardized and interoperable from the get-go would be a really important, would be a very important first step. The strategy also calls for stringent technical safeguards. So making sure the technologists and the programmers and the engineers are on board with building these safeguards and ensuring that these are carried out in an ethical and responsible way. And that there's a legal base to support any enforcement of these safeguards and rules. So that was important from the global strategy on digital health. There have been several bulletins around this topic, but one specific World Health Bulletin exploring the ethics and governance of AI for health brought up these points and spoke about, firstly, not just having legal oversight, but an ethical oversight is important here to make sure that any decision or any regulation has a patient-centric, empathy-driven model of healthcare, which is really important. Like I said, this technology is in fact an opportunity for us to get it right in a way from the get-go. And one of the key things would be to look at this from a human point of view, the person who is looking to get help from their healthcare. What drives them? What's important to them? They also mention accountability is an incredible, of incredible importance. Who is to be accountable for any breaches in patient safety, breaches in data security and privacy? All right, that's important. And that goes hand in hand with the last 2 points, really, with the structured evaluation. So in order to make sure that these AI interventions are working, we need to be able to measure the impact, measure the level of security, and measure the extent to which we can protect privacy. Another focus group basically on artificial intelligence for health, the FGAI4H, was also established not so long ago. And they spoke really to the transparent evaluation and using standardized, undisclosed data sets. So they spoke about being transparent and standardized throughout the process of integrating AI into health. That becomes incredibly important when we talk about the accountability and the regulation of this technology. Moving on to the special report here on the rights to privacy. And this is from the United Nations. We were very lucky to have Professor Joseph Kanatashi come to present on the launch of the PAN documents that we released earlier this year. And the take-home message from this document, there's many, and I implore you to have a look at their website. There's amazing articles on privacy from a gender perspective and the right to privacy in the digital age, which is an incredible read if you have the time. But the take-home message really is that privacy needs to be protected by default and to be integrated in the design and use of these AI or information systems. So it's privacy by default and privacy by design. That's really speaking to integrating the notion of what could go wrong and how can people's privacy be impeded on, and making sure we have mechanisms to prevent that and protect that from happening. The OECD basically mentioned again the unique privacy and bias that happens within healthcare collecting of biological data, of genomic data. How do you share this data in a way that is truly anonymized? How do you share this data that is in a way that you ensure that the wrong people do not get hold of this data? Health data can be incredibly proprietary. It can be something that is used for unethical and irresponsible purposes. So we need to look at those from the get-go so that we can make sure that we have fail-safes in place. They also mentioned, and a really important point, I think, for South Africa and Africa, is to make sure that we have the necessary infrastructure in place, that risk mitigation plans are in place. And I think these will involve stakeholder engagement across the platform here. And the last thing that they mentioned is trustworthiness and making sure that the systems we put in place are trusted not only by the healthcare professionals, but also the clinicians being, using these using these systems. And then very quickly, I want to talk about some of the findings from the General Data Protection Regulation. And I'm specifically looking at the emphasis on the rights of the individuals when it's consent. And in this case, informed consent. What does that really mean where, you know, the literacy around AI and data in the population is limited. Data means something very different to the person accessing healthcare than it means to, for instance, you and I. So to have informed consent is going to look very different from what we see it today. You're going to have to explain to people what their data is and the possible value that that data has before you even get to what you're going to do with that data. You've got to make sure that people understand what that means. And so the EU has also stepped in and spoken about the increased risk to privacy. How are we going to anonymize this data? And data is always being collected. As long as you're wearing your wearable device, your data is being recorded and collected. And is that part of your rights? Is that part of your informed consent? Do you know that you cannot, you know, that when you switch your phone off, that's still transmitting data, for instance? So all those things are really important. And they've also brought out the obligation of businesses, which I think is important here as well, of companies who develop these products to make sure that they are clear and transparent on how this data is going to be used. And I think we have a lot of work to do in that arena at the moment. And again, they reiterate the need for data breach protocols and knowing how to firstly, how to identify breaches and how to then compensate and deal with these breaches. Okay, and I spoke a little bit about the genetic data and how those special categories of personal data could be impacted. Moving on from those multinational organizations, or multilateral organizations rather, I want to talk about a group that I was very surprised to see had a lot of work done around the principles governing the ethical use of data. And these are the nonprofit or the watchdog organization. And I've just got 3 represented here, such as OpenAI, and they are calling for safe artificial intelligence throughout the healthcare. The Brookings Institute, for instance, talk about investing in infrastructure, getting high quality data that is representative. That is incredibly important in the South African context, where a vast majority of the AI systems are trained on large data sets coming from the West, for instance. That is not truly representative of, for instance, the health concerns and the nuances that we face within our own context and in our own cultural country, if you will, in a way. So data that represents your region, data that represents South Africans need to be used. I think that's an important point. The Brookings Institute also speak about, you know, integrating the various health regulatory bodies as well as health professions into this process. Algorithm Watch, for instance, which is really cool, they have spoken about, they usually debate a lot of the contradictions in the various national policies. So it's really good to get a sort of an alternate view from Algorithm Watch. So I implore that you look at those as well. And then I've looked at now the more national level policy, and I've just sort of summarized it. Hi.
5-minute warning.
Okay, cool. Well, I've got a few more slides, so I'm gonna rush through these. So some of the thank you, Vukosi. Some of the major findings from the government or the national policies is that they've recognized that they, as governments, will have to play a coordinating role, but it's an important role, okay? So and how can they do this? Some countries, such as France, have started investing 3 million euros, in fact, in STEM education. They started investing in oversight on monitoring AI and data use, such as the UK. The US has spoken about the right to an explanation, making the AI-driven decision-making more transparent. Calls for the inclusion of clinicians and scientists through the whole chain of development. And in the case of Rwanda and India, also speaking about the skilling and reskilling of the workforce. And then within the South African context, which I want to really speak about very quickly, is so bringing all that together to our shores. And we recognize that South Africa has unique socioeconomic and infrastructural challenges, huge level of inequality and unequal access to healthcare as it stands. We have poor data quality, where data is in the form of sort of unstandardized. We were just speaking earlier about something as simple as standardizing the date, how you record specific outcomes. If those are not standardized, a data engineer or a data scientist finds it very difficult to analyze that data. They'll have to go back and manually clean that data. It sets you back several months. And then another unique contextual challenge we have is our language and translational barriers. Luckily, we are not starting from scratch, and there's 3 pillars upon which we can build new policy. That's the National Health Act of 2003 with the POPI Act. And these speak about protecting confidentiality across even electronic transmission. And they speak about legislation around the collection, usage, and storage of information. And the mobile health policy, which spans between 2015 and 2019, speaks to mobile technologies and the smartphone, as a tool for collecting data in real time. And that's a pretty good step, considering our AI data in health is going to be in real time. And so these policies need to be adapted and built upon. And in last year, we had the National Digital Health Strategy, which spoke to these points. I'm going to go through them really quickly about developing leadership capacity, making sure all stakeholders are involved. They speak of reviewing and strengthening current strategies and implementing an integrated information architecture, speaking to the point early on with the interoperability of our systems. Okay, and they also point out that it's impossible to move forward without a formalized national policy around digital health. And so, having looked at the multilateral and national policies and bringing it together through the lens of the South African context, we have come up with a set of recommendations. I think there are around 8 recommendations around policy and practice. The first one I want to speak to is the recognition of human rights, making sure that any policy or any application is done in a patient-centric manner. The next point I want to make is around data quality and bias. Policymakers have warned that poor data quality resulting from either non-uniform or maybe incomplete or non-representative data will undermine the potential of this technology. It will further marginalize these isolated groups if we do not do this in an inclusive manner. The other concern is around transparency, and the recommendation from policy guidelines across the board is that we need to have guidelines for more transparent and explainable AI. Data needs to be correctly labeled and described so that clinicians can understand how this data is used for decision making. Another recommendation is to take cognizance of safety and accountability, making sure that there are policy officials and software developers and health practitioners that are aware of the shortcomings as well as the dangers and risks of this technology, and that they are accountable for these breaches if they do happen. The other thing I wanted to talk about was more along trust in patient-centered care, which I alluded to in the recognition of human rights. But the point I wanted to make here was there needs to be an interaction between healthcare practitioners, patients, as well as the developers of these technologies, if we are going to use it in a trustworthy manner. We also need to make make it known that there are going to be implications for the healthcare workforce at the moment. And so policy actors need to clarify how these platforms are going to augment healthcare and build upon the capacity that we do have, and ensure that these healthcare professionals are not left behind. So there needs to be digital health capacity development that occurs. We also need to talk about I'll come back to language now, but the integration of data and governance. And so this builds on from the National Health Strategy, where we need to ensure that the benefits of this technology are sort of almost ensured by making sure that data is harvested and integrated between healthcare facilities and shared across the board, and that this sharing is done through a standardized governance and standardized regulation. And lastly, we need to look at the implications for language in South Africa. Data used to train AI we need to take this into account. In South Africa, we have 11 official languages, as we all know, and there's linguistic and dialectic subtleties that need to be taken into account, or else marginalized groups may sort of experience even further isolation. Luckily, there's some good work being done by various South African organizations, such as the South African Center for Digital Language Resources, that are developing machine language translation for these South African languages, as well as other African languages. So, ladies and gentlemen, this has been, I know, a very, very long slideshow, but we've reached the end of it. Thank you for your time. I'm going to stop the screen share and then perhaps hand over to Vukosi.
Oh, okay. Thank you for that, Vedantha. I'm sorry, it seems something is up with my video. It doesn't want to restart. So yeah, I'll just keep it off for now. Yeah, I think it's okay. With the time that we have, I would like maybe, I think you've talked a little bit about the challenges that are in this space, but could you talk a little bit, like, you know, while we're gathering, so people can put up either questions in the chat, or you can raise a hand if you would like to ask a question live on there. Right, I would like to kind of say, like, in terms of now realizing AI for AI for health in South Africa, what do you think is attainable in the next year or two in the South African space? I would like to get kind of your view on that.
Okay, thanks, Vukosi. So in the next year or so,
you can switch your camera back on, I guess. Yeah.
All right, cool. Thank you. Yeah. Okay, perfect. So Vukosi, in the next year or so, I think South Africa is not alone in that we are going to be picking up the pieces from the recent COVID pandemic in the healthcare sector. So I think it can be viewed as an opportunity for South Africans to start developing a strategy around these recommendations. It's a starting point. It's by no means an exhaustive list of the problems that we could come up with. But as I mentioned, and as I found through writing these sort of topical guides, is that we are never starting from scratch. So I think in the next year, South Africa can do a great deal of work on looking at a way to drive policy forward, doing a complete landscape of what technologies are available in South Africa, where our capacities lie, where our weaknesses lie. That can be done within a year. And I think that's what we need to do. We need to get a landscape idea of what's going on, and from there, start working on those and prioritizing some of the problems that I think we'll find through that. Topical guides like this act as a catalyst for this conversation. So I'm hoping that this is what we will do going forward.
Okay.
I hope that answers.
Yeah, thanks for that. There's a question here from Zukisa. She's asking, in these guidelines, is there a consideration of using privacy-preserving machine learning methods? So machine learning on encrypted data, or I guess homomorphically encrypted data, given that the data is anonymized, can sometimes be relatively easily de-anonymized, which would defeat the purpose of actually anonymizing it. So basically, like, is there, like, within these frameworks, like, guidelines, is there recognition then on using machine learning on this encrypted data?
Yeah, I think it's definitely implied. I think it's a valid point that encrypted data is one thing, and then de-anonymizing it to make sure that you have no link to the patient's identity, which is a key concern. And we were speaking earlier about merging health ethics with data ethics, and I think this point speaks to that. We are treading sort of ground where we have this overlap, and we have this opportunity to come up with better technical methods of encrypting and encoding data. And I think the policy as such implies that we should look at this as a problem. Unfortunately, it doesn't come up with a set of, well, these are the alternatives, or this is what you can do. I think it is the purpose of this guideline to start engaging with the technical experts and the legal experts on the other side of the coin to try and come up with new techniques. So although the guidelines don't explicitly mention it, it is definitely part of it. So I take that point from Zukisa, and I think we should start thinking about that going forward.
All right. Thank you. From the participants, are there any other questions? Because then I can just go through more questions. If you'd like to ask a question, you can unmute yourself and then switch on your video to ask. Okay, okay, let me see. Okay, from my side, I guess there's a question then. If now we are working within these frameworks and we're working through also regulatory environment, a question comes up then to think about where's the promising research in South Africa, right? Because there are things it's always going to be that when you're doing research in the spaces, there's things you can do now, there's things you can do next year, and then there's things that you can do 5 years from now. Just because there's the landscape is changing, and the way that the expectations that we have for the way we should handle information like this, especially for AI or machine learning, will also change. At the beginning, we had this view, we had this very big view that, oh, AI will kind of revolutionize the health sector. But then people who work in machine learning in health know kind of you need to understand the environment, you need to understand the people, you need to understand kind of the data ethics that come in, even if there's all those things. But then if you given your time that you spent on this guideline, where are the promising research areas in the kind of short to medium term that some of our participants might be interested in actually hearing about?
Thanks, Vukosi. I just wanted to clarify, are we talking about research areas within the application of AI in healthcare, or specifically along the policy and ethics?
I think both. So it'd be very interesting to get a view from you from the application side, and then later on what still needs to be done on the policy side.
Yeah, no, sure, absolutely. That's a really cool question, Vukosi. So on the application side, there is incredible promise at the moment with, and again, with, the COVID pandemic, it has brought an urgent need for us to be able to better trace disease and improve our epidemiological work. So there's a lot of great applications for disease markers and mapping of diseases, which I think specifically in an African context is very exciting at the moment. I've always been incredibly excited about the work that IBM is doing in terms of their machine learning platforms and used for diagnosis, limiting the amount of human hours that need to be spent on certain tasks. And if there's one thing that we've learned from COVID is that healthcare professionals are incredibly overworked, and there's definitely room for us to supplement and augment their work. So I'm really excited to look at how the IBM Watson and similar hardwares and softwares used to change the face of healthcare. In terms of the policy, I'm very interested in the work done by the UN rapporteur, the rights to privacy. There's going to be an incredible wealth of knowledge that we get from those groups. I mean, Professor Kanatashi is a pioneer when it comes to this. I mean, 1987, he was discussing the possibility of a world with using big data and AI for health. So I'm looking forward to looking at how the UN expands on that body of work. And having said that, I'm very much interested in looking at how the countries that are not part of the UN, you know, like South Africa, are going to respond to that. And as it would happen, I've started looking at, in my own research, looking at something that I find very important, and that is how these international these broader international regulations and legislature and ethics, how that's translated into the national policies, and then how that's implemented on the field. So for me, it's a matter of not something that's easily doable. So if you're looking in the next year or so, that's not gonna work. But I'm really interested in looking at how the train of policy is implemented down the line, and then eventually looking at ways to improve that, so that the next time we have a new technology or we have a new innovation, we have a more adaptive and agile framework to work upon. So I'm really looking forward at looking at the dynamics of how policy is laid out and implemented. That's kind of my own very nerdy approach looking at that.
Okay, thanks for that. There's a question on saying, like, is there any value in shared data among stakeholders across administrative kind of domains? So this being then, like, you know, are there licenses, like, you know, solving problems in a common space, and then are there licenses that can assist with this?
That is incredible. I don't know of any policies right now, but I'll speak to the fact that I do see value in that. I think it's really important. I do want to definitely emphasize, though, that with data sharing, you open up to a great risk of sharing information, sharing possibly proprietary information about people and about their health status, which I find there won't be many issues in terms of you know, how proficient the systems are. It's definitely going to be an efficient system, but there's going to be a problem with how ethically that is done. And I think without one, you can't have the other. I feel very passionately about data sharing and doing that in a way that preserves privacy, that preserves the rights of the patient. And I'm very interested in seeing how that specifically pans out and how different stakeholders address that, if they do indeed address that. So thank you, Vishnu, for that important point.
Rachel, do you want to come in here?
Rachel
and
might,
also
yeah.
we start wrapping up.
So I just wanted to come in on this issue of data sharing and what frameworks currently exist. So Poppy effectively works to stop data sharing as it is currently framed. The way Poppy is currently articulated is that data sharing cannot take place unless there is express individual consent from each and every data subject, which is of course hugely onerous. So part of the issue that I am working on with colleagues, particularly in terms of health data sharing, is how to work through a purposive interpretation of Poppy so as to allow for data sharing for health research purposes. And the key principle here is, what is the purpose of the data sharing? So what Poppy is trying to work against is this commercialization of personal data, particularly where people are not aware that their data is being used. But I think Poppy, there was a question earlier about collaboration between public and private sectors. And I think this is where Poppy is quite short-sighted. It does not imagine sharing data between public and private entities, despite what purpose that might be for. So for addressing kind of challenges, so basically I think there's a lot of work that needs to be done to interpret Poppy in ways that allow for problem sharing, problem solving and innovation.
All right. Yeah, I'm really sorry. It seems my video still is, I don't know if people can see me or it's just me not being able to go in. But it's odd. Yeah, my camera doesn't want to come back up. Yeah, I wanted to really thank both Vedantha and Rachel for taking this time in the morning. We have this kind of very early so that, you know, you can have the rest of your day and then do whatever, but also kind of get the kind of brain flowing in thinking about these things. Again, people like myself come from machine learning and AI proper in a way that in terms of technical and all those things, but we do have these responsibilities of the data that we use, and most of the time data is about people, right? And we need to understand how we treat it with respect, and also respect all like, you know, the subjects who we ultimately we're trying to see how we can improve the lives of people going into the future on there. So like with these I think policy notes have been very interesting in getting us to think more broadly, right, of not just having a silver bullet, but of thinking then how do we bring this to the perspectives of us here in South Africa, but I think also broadly, let's say on the African continent. At the same time, being able to kind of inculcate our own values into the way that we do our research, right? We do have societal expectations, and we need to be able to make sure that we do not betray the trust of the people that we're working to assist in the future. So thanks for everybody for coming in. This will be kind of the end of today's seminar. We will kind of be having the next seminar being the writing workshop. We had to skip it in the past, so sorry about that, due to the speaker being sick, but she will be back in 2 weeks' time, and it will be in the afternoon instead of the morning, just to deal with the time. So thanks everybody, and enjoy the rest of your Friday. Thank you.
Thank you, Vukosi. Thank you, Rachel. Bye.
Bye, everyone.